Theoretical and practical questions of the non-invasive measurement of arterial stiffness. Part 6. Arteriograph as a useful method to screen for subclinical carotid atherosclerosis. The subclinical carotid atherosclerosis is a strong and independent predictor of cardiovascular events. For this reason, we aim to study the relationship between the arteriograph-detected aortic pulse velocity and the ultrasound-detected subclinical carotid atherosclerosis. 643 subjects were involved in the study. Their mean age was 57.2 years. They had normal systolic and diastolic blood pressure and heart rate. The total cholesterol was slightly higher, but almost normal in our population. Only 16.2% were smokers. The aortic pulse velocity turned to be 10 meters per second, which was slightly elevated, and almost half of the subject had carotid positive result, showing plaque or increased intima media thickness. We considered the carotid ultrasound to be atherosclerotic equivalent if we observed 1 millimeter or larger calcified echogenic plaque and or 1.3 millimeter intima media thickness. We determined the threshold of the aortic pulse velocity for asymptomatic carotid atherosclerosis. This value turned to be 9.3 meters per second using receiver operating curve evaluation. Using 9.3 meters per second aortic pulse velocity as a threshold, we found the sensitivity 76.5%, the specificity 64.5%, the positive predictive value 68%, the negative predictive value 73.6%, the relative risk 2.6, and the odds ratio 6 for revealing asymptomatic carotid atherosclerosis. The relative risk shows that among patients with high, more than 9.3 meters per second aortic pulse velocity, how many times more probable the disease, that is carotid atherosclerosis, than with low aortic pulse velocity subjects. Odds ratio shows that how many times higher the chance to diagnose the disease, that is carotid atherosclerosis, properly than improperly. The prevalence of carotid atherosclerosis was 49% in the studied population. Concluding these results, we can say that the arteriograph measured aortic pulse velocity higher than 9.3 meters per second is a significant and sensitive predictor and marker for the asymptomatic carotid atherosclerosis. Thank you for your attention.